Well, good morning. It's good to be with you. It's good to have Director Jared Moskowitz here. We have some updates on the vaccine distribution. First, I'm going to sign an executive order this morning lowering the age to 50, effective Monday. We think we've done pretty good this week with 60 to 64, but quite frankly, we think that even on current vaccine allotments, that opening it up will be good. I think the demand has been relatively modest. Certainly much more modest than it was at the end of December when we were doing the 65 and plus. So we think that this makes sense. And I think we'll see how it goes next week, but I think we will definitely be opening it up to everybody, certainly before May 1st and maybe much sooner than that. So stay tuned there. We've not been sure about what we were getting in terms of the Johnson & Johnson. As of, I think, 2 days ago, we had zero prospective allotments for J&J for the next 3 weeks. We have, though, now, next week, it's a lot less than our initial, but we're going to get another 42,000 doses of J&J. The next 2 weeks after that is showing zero, but I think what's happening is I think this is a dynamic situation. I think it's very possible that we do get some J&J during those two. Obviously, planning massive J&J outreach without knowing whether you're going to get it makes it a little bit more difficult, but I do think it's good. The response of J&J has been great. It was a little concerning because of the way it had kind of been characterized, maybe not as good as Pfizer, Moderna, even though the clinical data showed 100% effectiveness to prevent death and to prevent serious illness. And so we didn't know how people would respond, particularly some of the seniors. They had their hearts set on Pfizer, Moderna. Well, it turns out anytime we've done these J&J drives, people love it, and they love going in. I was in Panama City yesterday, and everyone, I asked, are you glad you're doing the one dose? And they were all big thumbs up. They were really happy to be able to do that. So Jay and Jared's going to talk a little bit about some of the distribution points that we're doing. It's an incredibly diverse array of ways to get this vaccine into our communities, and he can talk about how J&J gives you maybe some options when you're doing some of these expeditionary elements. So as we stand now, Florida's vaccinated over 3 million senior citizens. We're close to 70% of all seniors have had a shot. That was our goal starting out. We were the first state in the country to do seniors first as our priority. And I think that we've had a huge response from seniors. I think many of them have been very happy. I've been able to go to so many of these sites and pharmacies and everything, and when they're getting the shots, it's a big relief for them because this is something that they've had to worry about. So it's really been incredible to see so many folks be so happy, and then also be able to feel good about living life without as much worry as they had. So we think it's been really successful. Now, if you look at the numbers, say by each county, we have some counties like St. John's, that's 81% of seniors have had shots. You have here in Leon, they've done a good job, 76%, Lake 74, Palm Beach 72, Broward 70, Collier 71%. What happens is once you get over that 2/3 of seniors, it definitely starts to really slow down in terms of the demand. And so there's just a certain critical mass of seniors who really want it, but there's definitely a segment who are opting not to get it. And I think it's going to depend on each county, but I think you're looking at between 15 to 30% of seniors, depending on the county, will probably not opt. So we're closing in on 70% statewide. You know, we probably can get a little higher than that, but I would say once you hit about 75% based on what we're seeing with demand among seniors, that's probably the high water mark. As you go down in age, that high water mark is going to go down. It's just the reality. The demand is less, even amongst a 61-year-old compared to a 71-year-old. As we go down to 50, you get people in their early 50s. Some are going to want it. Some won't. Obviously, some have recovered from COVID and have immunity through infection. And then I think as we get below the age of 40 and into the 30s and 20s, I think it's going to be way less than 50% of the folks who are going to want it. But you don't know until you actually get it out there. We saw this past week with lowering it to 60. We saw some demand. There were a lot of people who had been waiting for it. but it was not in any way overwhelming. Part of it is we have more distribution points than we did back at the end of December. Part of it is some of the people 60 to 64 qualified because they had comorbidities, so they had already gotten shots. Some of them may have been in certain areas in healthcare or law enforcement or education where they had done it. But the bottom line is it's been very orderly. You've had people are able to get appointments online much easier now than when the first crush started at the end of December. So we feel confident going to a 50 plus. Makes a lot of sense right now, and I think that the demand will obviously increase in terms of people that are looking to get vaccine, but I don't think it's going to be anything that's going to overwhelm. And I think part of the reason is when we were planning on how to do this, and we had Jared and health and all these folks, we really did not want to be vaccines going through government and the state government being the one that's applying these vaccines. We wanted to facilitate this, but have a lot of different points where people could go. And I think that that's what we've been able to do, and I think it's been very effective. So obviously the long-term care facilities was our top priority. We did in the well, Jared, let me ask you, we had been discussing what we're going to do with LTCs. We were prepared to do them ourselves. Federal government referred us to CVS and Walgreens. So they were basically in charge of going to these facilities and vaccinating the staff and the seniors. When that Pfizer hit and CVS and Walgreens were not quite ready to go, we were able to marshal teams and do a bunch. And so can you talk about a little bit about the LTC and were we the first state to be vaccinating seniors in long-term care facilities?
Yeah, Governor, as you know, back in December, when we tried to turn on the federal long-term care program, from the day you turned it on, there was a 2-week delay because they wanted to set aside doses before the federal government would go into these facilities. We found that unacceptable under your direction, and we went into Broward County and into Pinellas County, into the nursing homes, and started the first week that we had doses. So we were one of the first in the nation to do that. And to date, the state of Florida has administered 111,000 doses in long-term care facilities, not just nursing homes or assisted living facilities. We've been in HUD Section 202 facilities, independent living facilities, APD group homes for individuals with developmental disabilities, adult daycares, and residential treatment facilities. And if you recall, when the federal program had gotten started, it was still not fast enough that we found acceptable. And so under your direction, you asked us to take over what was remaining. And at that point in time, we had to take over 1,500 long-term care facilities from the federal program.
And so we've done all 4,000 facilities have had, seniors have been offered shots and staff have been offered shots. We continue to, I think you guys continue to have some doses available as new seniors may be inducted who may not have had vaccination, and then as new staff are hired so that they're able to offer it to those folks. But then also some of the other things you're talking about. So you have 4,000 facilities plus these other facilities that wouldn't be considered LTCs. And nationally, if you look, because everyone was in agreement, you do the healthcare frontline and then long-term care first. So even though we did the broader senior community first, whereas other states were focusing on other segments, we all pretty much nationwide tried to do this. Obviously, Florida had a much, much larger task because of the number of facilities. But if you look at those numbers in LTCs, if you go on the CDC and look at that, I mean, it's been a huge, huge decline. And I think part of it is there's a seasonal cycle to this. There's obviously more population immunity. But I mean, it's been such a serious decline that I think we can point to the LTCs in the US and say that these vaccines are working, that they are reducing infection and they're reducing mortality in the LTCs. And the LTCs are anywhere from 30 to 40% of all the COVID-related mortality. So that's a huge layer of protection. and a huge way to be able to prevent mortality. We also, of course, had a number of doses, initially hundreds and hundreds of thousands to hospitals. We've continued to send hospitals. Hospitals from the very beginning were the ones who were administering it when we were doing Seniors First. The hospitals were doing people that were vulnerable to COVID regardless of age. And so you had people from the very beginning, some people that had cancer, or they had cystic fibrosis or something, they were 20, 30, it didn't matter. The hospitals were going and vaccinating those folks consistent with our directive. And that was really important. And that was something that was not necessarily getting as much attention. So they're still doing that, and they're working, and they're tens of thousands of doses a week are going to hospitals at a minimum. And so they've been a key component of this the whole time. We've also sent a lot, of course, to the county health departments. And some of that is you do it at the county health department, you set up different sites. There's a variety of ways to do that. We've had some pretty big drive-through sites in places like Hard Rock Stadium and at the villages. Jared was really, really good in figuring out, okay, you have hospitals, you have kind of these things. How else can we get in to get the vaccine, particularly in communities that may have more vaccine skepticism? So I think Florida, were we the first one to launch a church program, particularly focusing on African American churches? And how has that gone, and when did that start?
Yeah, Governor, so we recognized obviously early on that we had to become creative, and one of the first things we did is try to figure out where we were going to start. And so we started in the faith-based community, in the minority community. We went to Brownsville the first week of January, a community that had been hit hard by Hurricane Sally. We had done a feeding drive there, so we had already partnered with a church. That was the pilot program that we ran there in the first week of January. And since then, we've done 215 churches. We've vaccinated 70,000 people. In fact, the White House reached out to us about 2 weeks ago, and we gave a presentation because Florida has been the model for how you partner with the faith-based community. And in fact, they're trying to roll that out in other places, in other states that are having significant hesitancy in the minority community.
And we actually, Jared helped put together, we actually did a multi-faith event at a synagogue in Aventura. So you obviously had some of the folks who were part of the synagogue. They partnered with a Protestant church, and then they partnered with a mosque. And so you had a couple hundred people from each of those congregations coming to this synagogue in Aventura and doing some of these faith-based vaccinations. We also did basically, one of our philosophies was you fish where the fish are. Particularly early on, there was difficulty in sometimes making appointments. And so I know we had been working with these senior communities, whether it's the Villages, Century Village, Kings Point, with offering the rapid test all along. And so you were able to go, I think the first one we did was Kings Point, and get in and do really thousands of seniors. So talk about some of those early ventures and the success that you had there.
Yeah, Governor, speed was the name of the game, obviously. At the division from day one in March when this happened, we realized we needed to do things as fast as possible. Sitting down and spending months to try to accomplish things was not how we were going to get ahead of the pandemic. And so in the very beginning, we realized that we'd have a three-pronged strategy. We would have these open pods, large drive-through sites. We would partner with churches in the minority community, whether that was in the Cuban community, the Puerto Rican community, the Haitian community, the Caribbean community, and we would also bring the vaccine to these large areas that had concentrations of seniors. And so that way you were not clogging up sites. There are people who, don't move as fast. They're in their 80s. They don't have transportation. And so, we've been able to do 126,000 doses of the vaccine by bringing it to these large places, going to their auditoriums, going to their, to their rec centers. And we did that in Kings Points. We did that in Century Villages. And when you talk to these people about how easy we made it for them, there was just multiple different ways in which we could get the vaccine out. And as vaccine became more available, right, we were able to expand that. But in the very early days, that turned out to be why, quite frankly, Florida has vaccinated more seniors than any other state.
And we had done some events. I remember we were in Hernando County doing one of these senior communities, and there were seniors that just because we were in the community through word of mouth, like these are folks that you know, some of them were in their 90s and they may not have known to go on a website or some of those things were a little bit more difficult. So you end up, and I think it's true with the faith-based as well, because you have the pastors getting people in, proactively doing it. Same thing when you're in these senior communities. And quite frankly, same thing with some of the counties. I mean, I could tell you, if you look at some of the counties that have done well, and I think Leon would be one, they've been very proactive. So there'll be people that'll say, yeah, the Leon County called me, said, you know, you're 70 years old, do you want a shot? We'll go. And some other places have done that. So that's been, I think, helpful. The retail farm, and we'll talk a little bit about that. I mean, I think it's great and it's good for probably 90%, but it doesn't capture everybody. And I think these have been ways. And then I think maybe the most significant way we've done it is the Homebound Seniors Program. So I know we started doing it. You had reached out to a lot of the Jewish community, particularly focusing on Holocaust survivors. Then we started working with the veterans community, focusing on our World War II vets. But I think we've done thousands of seniors now through the Homebound program. So can you talk a little bit about that?
Sure. So we've done 3,500 seniors, vaccinating them at home under the Homebound program. And in fact, Governor, you launched an email address just last week for more people to sign up under the Homebound program. And since we launched that website, we have 4,000 new people that are asking us to come vaccinate them at their home that are homebound. And in fact, this weekend, we're going to do 2,000 of those 4,000 based on putting 1,000 nurses out into the community. Additionally, you know, not just with the Homebound program, but trying to increase people going into the community. I mean, we've knocked on 35,000 doors. By the end of today, we will have knocked on 35,000 doors across the state in the minority community. We're doing about 9,000 doors a day now, trying to get people appointments by going to their home. And in some areas, we're even offering the vaccine at the door. We're piloting that to see if that's successful. And so all these different outreach efforts, all these different pockets, each one obviously, you know, helps try to increase shots in arms.
When you do the home or when you knock on people's doors, what's the response rate been of people who ultimately want to get the vaccine?
So we're finding it's about a 10% conversion rate, right? It's not, you know, and that's why it's hard to do these things as far as, you know, trying to, with speed, right? This is something that is just another tool in the toolbox. It's not going to obviously increase shots in arms tremendously, but there are people obviously in the minority community that have transportation issues. They might not have a car or they share a car. There's education issues, so when we come to the door, we educate them about the program. There's historical hesitancy issues. And sometimes we find out that, you know, they were just waiting because they were waiting for somebody else in their family to be eligible. And so, you know, this multi-pronged approach, you know, is how we continue to make sure that we're giving the vaccine to people who need it, and that obviously we continue to try to get ahead of the virus.
So for the Homebound, I know when we launched that, we didn't have J&J, and so a Homebound visit was really Homebound, and then we're going to see you in 3 weeks or 4 weeks. Are we trying to use exclusively J&J on Homebound?
Yeah, that's right. So we're using J&J exclusively on Homebound. When we're knocking on doors and offering the vaccine, we're using exclusively J&J. And then now we have these mobile units that we've contracted to us. We have 3 buses out there. We'll have 15 buses within the next 2 weeks. Those go up literally, they set up on a block in communities that are socially vulnerable. They're there for a day. They move to another block for a day. And we're doing exclusively Johnson & Johnson because obviously it's just much easier to do it once and then move and continue. It's just logistically much easier.
We also, as the vaccine has become a little bit more prevalent, we've been able to provide it to physicians' practices. So some of the larger practices have asked, and now they can only do so many, but this way they're able to reach out to their patients who are eligible, offer them to come in and do it. They can also offer it ad hoc if they have somebody that's 61 that's coming in for something else. Hey, have you been vaccinated? If not, you can do it. And then also working with some of the health plans. Again, they have members that are part of their health plan, so providing them the vaccine, they can proactively go out to ask people who they usually do services for if they want the vaccine and be able to do it. I think when, again, this is not like, 100,000 shots for like a health plan, but I mean, you're doing hundreds of thousands a week potentially, and when that's spread throughout the state, it really makes a difference. And then the retail pharmacies, I think we were certainly one of the first to do retail pharmacies, and of course we were doing CVS and Walgreens for the long-term care facilities. We also said we want to be able to get it in from pharmacies in people's neighborhoods. We didn't want to do it right then with CVS and Walgreens because we really wanted them focused on our long-term care residents and staff. So we talked with Walmart, Publix, and Winn-Dixie. Publix, and look, they all wanted to do it, but it was also something that they all wanted to do it right. So Publix was the first to be able to step up and do the pilot that we did in the 3 counties in Central Florida. It worked very well. I mean, when we launched that, I showed up that weekend and I just talked to every senior I could find, and they all thought it was good. So I said, okay, retail pharmacy is good. So let's expand that. So we're able to expand first with Publix, then with Walmart, and then once the CVS Walgreens mission with the long-term care ends, we've now done a lot in CVS. And I can tell you, if you look, I mean, we track the senior coverage rates is kind of what we've looked at from the beginning of going seniors first. And you look at a place like Palm Beach. I mean, arguably, you could argue Palm Beach has done the best given how big their county is, how many seniors, and they've done close to 75% of their seniors in Palm Beach County have gotten shots. I mean, it's like almost 270,000 seniors. But at first, yeah, we did Kings Point. We did some of these things. It was good. But there was a lot of demand, and they don't have the same type of hospital system, I think, that like a Broward or Dade, where like a Jackson can be the 800-pound gorilla. So we went, and I met with the county mayor, I met with some of the administrators, some other folks who said, okay, here's different options. We could set up more drive-through sites, or we could do retail pharmacy. And they literally had someone look up Publix. Hey, we have so many Publix here, 90% of seniors live within a mile and a half, let's do it. So we put it in. And Publix like, we'll put it in every Palm Beach. And literally, Palm Beach went from probably below the pack, and it shot up over a 2, 3, 4 week period, because in each store, they're doing 40, 50 shots, 60 shots a day, spread out over 65 stores. It did it. The other, I think, good example of that is in Dade. So Dade is now 2/3 of the seniors. So Dade is basically at the state average, maybe a little ahead. They were below the state average. Obviously, massive county. They do have a strong hospital system. They have that. When we did the Navarro and CVS EMOSs, there was 67 stores. And so what you started to see is Dade just move up in the senior coverage because it's infrastructure that's already there. And you're able to do, in CVS, they do at each store on a daily basis, they have 2 different models. One is 100 shots a day, and the other is 200 shots a day. And so that adds up very quickly. So we're now in a situation where CVS has expanded to, I think, close to 200 locations, like about 100 and maybe 175. Walgreens has expanded, which is good. Walmart and Walmart is over 200. And then Sam's Club, who's Sam's Club? Yeah, Walmart and Sam's Club. Yeah, so they're over 200. Publix is 700, I think, and 50. I think our goal is, I think Jared agrees with this, if we were to get 100,000, 200,000 extra doses, we would give the vast, vast majority of that to CVS, Walgreens. Because I think if we can get it in every CVS, then this thing becomes something that is really, really easy to get. And so I think that the retail pharmacies have been very effective, and I think it's something that has proven to be the right strategy.
Yeah, and Governor, we're always trying to think and retool, obviously. It's not just about more locations, but the weather is going to start changing here soon. So getting into more brick and mortar buildings rather than outdoor tent locations, that's another reason why to continue to push into the pharmacies.
What else are you doing? You had mentioned what we did with the churches, particularly African-American churches. You talked about now going into expeditionary. I think we're also opening up some new sites. Can you talk a little bit about that?
Yeah, Monday, Tuesday of next week, we'll have 9 more dedicated sites just in the minority community. You know, one of the other things that has been talked about, but it really is a major issue, is the digital divide in the minority community. So, we were one of the first in the country to open these sites and just totally eliminate appointments. you can come whenever you want. In fact, when the federal government, reached out and talked about opening up, federal sites, and it's in partnership with the state. The state helps run them. It's a dual role. We said, listen, if we're going to bring these sites in, we got to make sure that we're hitting different populations. And so we said to the federal government, we didn't want these sites to be appointments. And actually, we were the first ones in the country to do that, to allow people just to come when they wanted without appointments. We were also the first in the country, Governor, to say to the federal government, we didn't just want these stagnant sites. We wanted what we call spokes to work off of the hub sites to go deeper into the community. We were also the first in the country to do that. And between the not doing appointments and using the spokes, we've seen that in the Black and brown community, almost 50% of the people that are using these sites are from the Black and brown community. And the federal government now in other states is having sites that don't have appointments, that allow people to walk up, because they're just finding that when you're dealing in these socially vulnerable areas, that model seems to be winning out.
Yeah, and I also think just that model is more plausible now than it was at the end of December. I mean, when we opened 65 and plus, you had a couple areas that decided to do the walk up. You had people that were waiting a long time. Some of them were getting there like 3 a.m. or whatever. And so the appointments was probably the better way to go to kind of get through that initial rush. Well, now you're in a situation where, because I remember when we did the first retail pharmacy, appointment only, had we just said there would have been hundreds and hundreds of people that would have been showing up. Well, now we're in a situation where, having these appointments or something that's still probably good in a lot of respects, but I think you're not in probably quite the danger of getting things just overrun. So I think it's applicable really across the board, where you'll start to have more walk-ins. On our current tempo, we've basically been pretty flat in terms of the number of vaccines that have been allotted to Florida. And you really got to go back and look at the previous week because of the amount of time it takes for the shots to be reported. We would love it to be instantaneous. It just doesn't work that way. But if you look at like last week, and I think the trend is continuing on this week, even without having the full reporting, during the weekdays, we typically do about 150,000 shots a day between initial doses and second doses. And then on the weekend, we do usually about 150,000 total. I think is kind of where we're settling in now, both Saturday, Sunday combined. And I think that there's capacity to do more as more vaccine comes in. There was a little bit of dip a couple weeks ago because of the storm, and the Moderna was delayed. Then you started to see an uptick because we had 2 weeks of Moderna, basically. So you had some huge numbers that first week of March. Now we're kind of settled into the normal rhythm, and we're basically just waiting to get either more J&J or more Moderna. But I think our Moderna has been pretty much the same for a long time. Pfizer's gone up some. Some of it is they are reclassifying how you count Pfizer. They're counting that extra dose, which they didn't do for the first 6 weeks or so. But we're in a situation now where we could probably do 200,000+, I think, doses. What'd you say? The capacity throughout the state, you could do 200,000+ shots a day, right?
Yeah, and increasing these sites, it's just adding more staff. When we built these sites, to have the capacity to do first shots, second shots simultaneously, because we understood that we didn't want, obviously, sites to stop taking in new people when we were getting to second shots, and that as more vaccine became available, we had the ability to expand. So it's really just adding additional logistics. So, but now that there's so many distribution points, physicians groups, retail pharmacies, hospitals, and obviously the city county sites, the county health department sites, the state sites, even as more vaccine comes out, we don't even know that we'll have to expand dramatically. We think we can take in, based on the footprints that we currently have built, the amount of people that want to come and get the vaccine, because there's just so many more points of distribution now than there were, obviously when this started.
Well, and with CVS Walgreens, I mean, you could expand CVS to, I think, over 1,000 CVSs. So right now they're doing about almost a little less than 200 total statewide. You could get it into 1,000. And so you do the math. I mean, 100 100 shots at each one a day. Some of them will do 200 shots. You start to see those numbers go up really, really quickly. So we're excited about the progress. I think that seniors first is what we did. We're getting close to 70% of seniors. And as I say, you're not going to have 100% on this in terms of the uptake. And I think most of the places we've seen, once you get into the 70s, it really, really does start to slow down. Now, obviously, we want to get in every nook and cranny. That's why we're doing homebound seniors. That's why we're doing some of these other things. But I do think being 50 plus on Monday is appropriate. I think that we have the tempo to be able to handle that. I think even though we haven't seen increases in allocations, I think the demand has softened enough that opening up to 50 plus will be good. We'll monitor to see how next week goes, but we figure out pretty quickly. I mean, we were getting reports by Tuesday saying, you know, we opened up appointments and it took 5 hours to fill. That would not have happened at the beginning of January. They would have been gone in 5 minutes. And so as we see that, we're like, okay, well then maybe we can again go more. So we'll do the 50, and I think our next move will most likely be to just say anyone who qualifies under the EUA, so the 16 or 18 up, depending on the shot, we probably can just open it up to everybody. And so I can't tell you when exactly that will happen, but I can tell you it will definitely be before May 1st. That's not even a question. And so stay tuned on that. Okay, couple questions? That's not true. Most of these, I mean, we have thousands of distribution points. The tempo has been good. When we see it softening, we're expanding it accordingly. We were initially planning on doing 55 plus, but you know what? We think that the demand, the supply will be sufficient to cover the demand at 50 plus, and so we're going to do that. And I think it'll be good. Yes, sir. It's not his decision to make. So, you know, it's just there's a structure in the state of Florida in terms of how these decisions are made. You know, I would note, you know, Orange County is below the state average in seniors vaccinated. They're at 63%. You know, trying to do healthy 40-year-olds over finding maybe some more seniors, to me, would not be the direction that I would go. Yes, sir. I have not looked at it, and obviously I put my John Hancock on it initially, so I obviously supported it. Yes, sir. Anybody else? Yes, sir.
Governor, I'm curious, you mentioned that you're worried that some of the populations or the vaccination rates will drop off as we get down to those lower populations. Are you still encouraging everyone to get a shot? Are you encouraging people to get a shot?
Oh, yeah, no. I think these are good vaccines, 100%. But at the same time, you know, you look to see kind of what the uptake is. I mean, and we got a little bit of sense of this right at the beginning when we had it in the hospitals, because you would offer it to these are frontline doctors and nurses. The uptake for the doctors was probably 90%. The uptake for the nurses, well, there was some discrepancies. I mean, there were some hospital systems where you had about a 33% uptake. Now, granted, most of these folks are younger. They've been involved with COVID. Maybe some of them have had COVID, and so they made the decision that way. But it's just a reality that as you get further down, the demand is not as intense. But I think that the vaccines have proven to be good. I think that we are seeing some benefit of that, certainly in the long-term care. I think we probably are seeing some benefit in the overall senior population in Florida. Now, the whole COVID has gone down nationwide, but I think in Florida, the 65 and plus has gone down a little quicker. And I do think that the vaccines may be a part of that. We'll know, I think, a little bit more as once we get 2 weeks out from most people having had 2 shots, then we'll really know. But I think there's been a lot of benefit, and the Johnson & Johnson, I think, is really encouraging for that. You know, at the same time, we really believe that this is something that people have to make decisions for themselves, and there will not be any government mandate on people. We also had this discussion yesterday about these vaccine passports. we're not doing vaccine passports in the state of Florida. It's just not going to happen. One, it's not fair because there's some people that have recovered from COVID who may not even be eligible for the vaccine, or maybe they took a monoclonal antibody. But we do want to make it available for folks on a voluntary basis. And obviously, we wouldn't have put all this infrastructure behind this if we didn't think it could be something that would be beneficial for Floridians to be able to do.
And some of these sites, FEMA sites included, there's pictures, there's reports that the demand has softened because there's not enough people going in there. So with that, why not add something to your...
So the FEMA sites are different. The FEMA sites are not, they're not our sites.
Why not add something to your executive order that allows these sites that if there is no one waiting in line, that they're allowed to maybe take those who would like it if they're not at that age?
So, well, a couple things. One, we've always said from the beginning, if you open a vial and you have a shot and someone cancels an appointment, you put it in somebody's arm, and that's totally fine. You know, we believe the 50 is going to work to start, but we're going to be very nimble and be able to do. I would say though, you know, there are people who are in higher risk groups who still need to be reached out to. Like, yes, we've done a great job with Seniors First. We've been able to do millions of seniors. If you look at the percentage of all the shots that have gone to seniors, the number of seniors, the percentage of seniors, I mean, we're one of the top performing because we put so much emphasis on it. But I do think that there's some more folks. I think that, you know, these counties, we want to see 2/3 plus of seniors, and I think you'll be able to do it. So it's some of it is, how much are you going to be reaching out? And we want them to be reaching out. Like Leon County, they have 75% of seniors. And I think part of the reason for that is because I think they've been very proactive. I think some of the other areas have been very proactive. So we're going to do 50. We'll see how it goes. But if the demand's not there at 50, then we'll make the change to be able to go to see where the demand is. But just understand, people like you, if there's a line, you would be complaining on the opposite way. You know that, you would definitely. You'll find something to be able to say, why is this happening? Why is that happening? You know, at the end of the day, I think, you know, we're trying to do it in a way that's efficient for people, that's effective, and that is still trying to target the people who are more at risk. And the fact of the matter is, you're more at risk at 53 than you are at 33, all other things being considered. Okay, thanks, guys.